Welcome, everyone. Thank you for joining us tonight. We're so happy to have you here for the third installment of our summer workshop series. If you haven't already, go ahead and meet yourself. My name is Leslie. I'm from Raleigh, North Carolina. I'm a second-year PA student at the dual Master of Public Health and PA Practice program at Campbell University, which is in North Carolina. Currently, I'm serving as the Advocacy co-chair in the Student Alliance, which is the student leadership arm of PAs in Asian Health. I wanted to thank you all for being members of PAs in Asian Health. Could you introduce yourself, please?
Yeah, I'm Danielle Miguel. I'm based in the Bay Area. I'm a PA, and I'm also in charge of the outreach committee for PAH. We're glad to have you all back for our third series workshop. And my role for today will be tech support. So I'll be monitoring the chat as well as helping out with the presentation slides. Leslie, you're muted.
Thank you. Go ahead and join the Menti on the screen here. You can either scan the QR code or you can type in menti.com and then put in that code. We're going to do a quick poll. Well, I logged on. I just wanted to say, if you're a pre-PA and you're able to make it to our first two workshops, you already know a lot about what a PA is. You already know what our profession stand out and how we can stand out as an applicant to PA schools. You've already decided that PAs the path for you. But I'm super excited for our PAs. Today, we want to shift the focus a little more broadly to hear from a panel of one student and 4 PAs in various stages of their careers, because we understand that it's easy to get caught up with the strength is provided when you're in this stage of your life, of your journey as a PA. But we hope that today you can leave the panel understanding what kind of PA you want to do. What makes you stand out as a PA or a future PA, and then open your mind to things that you could be involved in through your journey, like education, advocacy, or entrepreneurship. We've got some great people on our panel today to talk about that. So like I said, we'll start with some housekeeping and then introductions to our panelists. I'll ask you a couple of questions to get us started for the first portion, and then we'll leave the rest of it for Q&A to allow for audience questions. And please stick around so that Danielle can take pictures. Mine as well, so we can host that facilities. Great. Moving back to the Menti here, I see who has entered. Also, looks like there's some strong show outs for school workshops. That's just good for us to know, that some of our panelists have met y'all before. Okay. Next question. Where are you joining us from? I want to know where you guys are from. So this is Peanut My Cat. He's joining from North Carolina. And he loves that thing. It's from Aldi, if you want that. I think I got it like 3 weeks ago. You're West Coast. Lots of West Coast. I'm an East Coaster, so we'll work on membership for East Coasters. Love to see it. All right, moving on to the next question here. Where are you in your PA journey? So I'm curious to know how many of y'all are pre-PA students, or current PA students, or if you're already established. I'm just here for fun. Okay, really early in your journey. He's like, that's awesome. We're really glad to have you. Wow, okay, 7. And that's more than I thought. Early career, yeah, love it. Hopefully this can all be useful for everyone today. Everyone at any stage. And that's my cat Basil. He's journeying with his package to deliver it for Target. Okay. Hi, and now, this is really small, I apologize, but could you just let me know what specialties are you interested in? Because I like to see kind of the breakdown, because I think personality correlates with specialty. But I didn't put research or genetics on there, I'm sorry. I couldn't say any more without making it too small. That's psych. So peds, internal medicine, derm, peds. I'm doing my peds rotation right now. I'm really enjoying it, so good choice. Okay, no love for urology or ENT. That's okay. All right. Okay, well, thank you so much for answering those questions. Happy to knowing y'all better. Switch back to the presentation here. Once again, feel free area. We'd love to see your faces tonight, but fully understand if you prefer not to. It's optional. And if you don't mind just keeping your microphone muted throughout our presentation, and then you'll have the opportunity to unmute when Danielle needs our open Q&A. Any questions before we start for Leslie?
All right, first, I'd like to introduce all of our 5 panelists, moving from left to right. Go ahead and unmute yourself. Tell us your name, what specialty you are in, or what specialty you're interested in, how many years you've been practicing, for where you are in your PA journey, and then where you're located. Starting with Joe.
I guess it's me.
Oh,
Hi, everyone. My name is Joe. I currently attend University of Southern California primary care PA program. I am a second year. I'm originally from South Korea. And yeah, I'm super excited to be here. And I also serve as the Western Regional Director on the AAPA Student Board.
Hey everyone, my name is Trips. I am an early career PA as early as it could be, less than a month. I passed like 2 weeks ago in plan. I have a job offer in both emergency medicine and hospital medicine, so I can talk about that. And I did multiple rotations in each one, so I can talk about what I'm going to be doing. And located right now, I'm actually in LA, California. That's where I'm from. I decided to visit my family. But I will be in Norfolk, Virginia, which is where I went to school at Eastern Michigan Medical School.
My name is Christine. I am a first year practicing PA. I'm almost a full year in, and I'm in transplant surgery, solid organ transplant here in New York City. So I'm very excited to be here and answer any questions you may have.
Hello, everyone. My name is Gwen Park, and I am practicing in genetics. I work at the NIH. I'm in what they call the DMV area, which is DC, Maryland, Virginia area. And I have been a PA for over 20 years. So definitely not an early career PA, but I've worked in many different fields. Cardiology, nephrology, environmental medicine. I've taught in 3 different PA programs and worked primarily in research.
Hey everyone, I'm Alex. I am a business PA. I'm very different. I left clinical medicine in 2018, but I spent my first 10 years in trauma surgery, family medicine, neurosurgery, and then I pivoted into the administrative space, in which I learned everything about healthcare payments and payment reform with the government programs. I'm in the syndicated investment space and also helping medical practices stand up. I think that's all I'm going to share for now. Thank you.
Thank you all for sharing. All right, we're going to move into the first portion of our panel. We're going to go chronologically. So starting kind of pre-PA to the PA student, early career, and then kind of like what you're doing now. So I will call on a couple of y'all to just share. First, I want to hear from Joe. Can you tell us a little bit about what made you choose to become a PA?
I didn't know I was being interviewed. I just had, I'm triggered. So I don't have like I think a lot of students have like this was like the moment I decided, or like growing up, they have some kind of story that it was inspired by a PA, right? But for me, I grew up immigrant Korean household, and I always knew I wanted to go into healthcare, and I actually was a pre-med at first. I studied neuroscience in college, and that was the route that I was going. The PA route wasn't really informed for me at that time, so I didn't know it was available. But during my gap years and during COVID, I did get to work with a team of providers, which included a PA, and that's where I kind of pivoted. So I did it during my gap years, basically, and then eventually applied, but I was a non-traditional first-time applicant.
I think a lot of people have that same experience. So I don't think you're the only one.
Hopefully it was a good answer.
I thought you meant not pivoted, but more you found the light to the right path of the tunnel.
Exactly.
Christine, I wanted to ask you a little bit about your job. What do you think would surprise someone about like the day-to-day work that you do as a transplant surgery PA? A lot of people might not know.
I think a lot of people would be surprised to hear transplant surgery, and they immediately think surgery, like most surgical specialties. And I absolutely did not want a surgical specialty. I did not want to be in the OR. I hated intra-op. I didn't think I would like pre-op or post-op care. And then I learned about transplants when I attended the AAPA conference when I was in PA school. I met a bunch of transplant PAs. And I was like, oh my God, this is so cool, because all I wanted to do was like internal medicine. I wanted to become a medicine PA. I loved medicine. I wanted to practice it. And when I learned about transplant, someone once told me that it was actually medicine on steroids. And I was like, great, that's exactly what I want. I wanted like critical care. I wanted maternal medicine, and this is kind of like the love child of it. And that's basically what I do. And I love it so much. I do pre-op, so I manage transplant patients all throughout their post-op care. So they could be 1 day out of transplant, or they could be 5 years out of transplant and they're facing rejection. So it's a wide range of things that I do, and I love it.
Just to get a little more exposure on different specialties, could our other practicing PAs or formerly practicing PAs share about what they did and what it was like day in the life? I know you worked in a couple different specialties, right?
So genetics is a really great specialty if you like internal medicine and if you really like the whole getting to know a family and a patient very in depth, if that's what attracted you to medicine. And it's very much built on your history and physical exam skills, because a lot of times there are subtle things that people miss or they're not realizing. So I like the complexity of the medicine behind it. And then if you can find and diagnose somebody early on, you can completely change the trajectory of someone's life, especially children. So that's interesting, but it's very intensive in terms of like the visits with the patients, because you're trying to help them find services. It's very, we talk about PAs being team-based, but it's very much about developing a care team for them. And so they may need PT and OT and, social work, and maybe they need other types of services. So you're trying to help them navigate that system, all while they're trying to navigate, getting the testing and then the results and that kind of thing. So genetics is interesting in that way. My first specialty out of PA school was cardiology, which I hated in PA school. So I can identify with this whole thing that Christine was talking about never surgery, because I really hated EKGs. And then started out in cardiology, and I really like the intensiveness. Again, it's that relationship with the patient where you can help them either never have another heart attack or prevent them from ever having one, because we were very much a preventive cardiology practice. And it was nice because I got inpatient hospital time and also clinic time. So those are two. There's a lot more, like the consult nephrology service I did at the NIH, also very different, but we can go into that later.
I'd say trauma surgery is full of action, similar to like the pit, except like, less focus on the ER side, more so on that one character that's a surgical I think she was a fellow or surgical resident, one of that. The dynamics are there, egos are there. Being able to really learn how to navigate people is very important. The intensity is up and down in terms of when stuff happens, and it could happen in clusters. You can have a very, you don't want to say quiet, but when you say quiet, usually disaster happens. So you're always hyper vigilant. But if you master it, then you're really good at organized chaos, which kind of where I learned a lot about like triaging and timing and time management, because you have to manage floor patients, you have to manage folks that are coming in. Sometimes the residents are in the operating room, so you'll be dealing with the consult. So you're not only dealing with stuff that's coming in acutely, you're also dealing with stuff that's coming surgically as well too, as an acute care surgery service. It's fun. You learn a lot. You're always challenged, and it's a public hospital, so you deal with a lot of different type of patients, underinsured, uninsured. But trauma days was less technical for me, which is why I decided to go into neurosurgery, and neurosurgery is more technical. Everything was technical there. It was operating 24 hours. all types of cases. Obviously, in the beginning, you did less, but once you get a skill set hashed down, then you're pretty much needed in most of the cases, especially the big spine cases. And which to me was fun until it got to a point where it becomes not that fun anymore. When you're, when the staff can turn over a room very quick, and you only have so little time to eat in between and go to the bathroom, and then by the time they're in the room, it's like a show again. Flip the patient, put the images up, get the C-arm, mark the spots, and talk and discuss with the team what we're doing. So it's a different type of chaos that is more structured. Both scenario from trauma and in the OR neurosurgery, everyone has a role and it's defined. And if a role is missing and it's high priority, one would know how to fill the gap. And so that's the uniqueness of, as what Nguyen said about playing in the team base, and that's very team based right there. Family medicine was more very relationship based, a lot of chronic illnesses. In the Chinese community, you're seeing about 50 to somewhere, my max was 60 patients a day, in which, some people are afraid of that, but that's the nature of our clinics in New York City, which is why not a lot of Chinese Americans end up in a hospital. When they're in a hospital, there's a reason why they're there. They're really sick, and they can decompensate pretty quick. I can go on and on, but I think I'm going to stop there.
Thanks so much. It's so interesting, even for me, to hear about how broad the experiences we have here and things that you can do as a PA, and to hear the inspiration behind why you do what you do or chose to do. Jumping back, I wanted to ask Fritz a question about what advice you give to yourself as a pre-PA.
It's a good question. I would say my number one advice is that only you really know when you're ready to apply to this profession, because each person, each application is so individualized that you really know if you're ready. Meaning that what you would also know your own weaknesses and your own strengths. So to me, I knew that transitioning from my prior career as an accountant, my weaknesses was that I didn't have any of my classes. My GPAs were low. I needed to take all these prerequisites, and I didn't have any hours or any experience. So my whole application was weak. And but I turned that into a strength, because when I became an EMT phlebotomist, it was during the pandemic, and this was a time where you could technically do all of your classes online, whether it's your microbiology, your organic chemistry, or your lab. You can do it all online, and you can also work at the same time. So that's how I was able to do so much in such a little time. But I would say that the climate has changed now, because a lot of these programs don't take online classes now. It varies. You really need to check and do your own research here. But I would say to just be honest with yourself, that only know when you're ready to apply. But then also seek advice and mentorship, because some people might think that they're not ready, and then you talk to someone and you're like, hey, when I applied and I got in, I had a lot of similar stats as you. So, just go ahead and submit, and then, the worst thing they could say is no. So, but you also just don't want to submit an application to a program where you don't meet the prerequisites. I remember I applied to one program, and I realized that my organic chem was 6 years old, and they don't take anything over 5 years old. And so I remember I applied, and next day I got the rejection letter automatically. And it sucks, but at the same time, it's I should have read the requirements before I did submit. Other thing is also just know how expensive the whole process can be. Because the other idea is you can apply to Clinton schools, but then after your first application, each additional application, it can add up. So it's you can cast a wide net, but then how wide of a net you can cast is how much you can afford per application that you can pay for, right? And then you don't want to like do all that when you realize that your application isn't exactly the strongest it could be. So you really have to play around in terms of like when I should apply, if I'm applying too late in the cycle, versus like maybe I should apply late in the cycle because that means I can sneak 1 or 2 more classes in when this semester ends, or I can work a couple more shifts as an EMT, and that might make me even more of a competitive applicant. So yeah, you got to really balance that internally, and then from there you can decide whether or not you're ready to apply.
I really like your first point about like, when it's time, when you're ready, because I definitely had that experience. And I know we have a bunch of pre-PAs that are very early in the process. And especially having Asian parents that didn't work in healthcare, I don't think they understood that that's the process, that you don't just go straight into like applying right after undergrad. You have to take years to get that experience. And mine just didn't get it. They were like, why didn't you apply this year? And explaining that to them was difficult. But looking up to finding mentors was something that really helped me.
Yeah, my parents actively tried to get me to go to med school. And I'm like, I'm not doing that. It's not because I didn't want to. I like the fact that we're just so versatile, and I'm not interested in going to like 3 residencies. PGY 20, not doing that.
I agree.
Jokingly, for me, my parents actually thought I went to med school who became a doctor because they had a white coat, and I had to explain to them all together, like, no, I'm a PA, this is what we do. And they had to anything. They're like, so you're a doctor, right?
I was curious to hear from Joe, since you're the only current PA student on the panel. What is one thing that you were really worried about going into the process that ended up just not mattering, or like that was fine? Was there anything like that for you?
I think there's 2 things that worried me the most. Was I had taken 5 gap years, so it had been like a minute since I was in school. So, people say the saying of like, it feels like PA school is drinking out of a fire hose, but I don't mean to like scare like students. I think personally for me, it felt like I was drinking out of Niagara Falls. But everyone's experience is obviously different, right? But for me, it felt worse because I hadn't been in school. So, when people talk about how rigorous school is, I really felt it. But I think because at the same time, I was a little bit on the older end of the applicants or people who got in, I felt like I had more experience of being level-headed when it did happen, because I had a lot of like experiences that helped me be grounded. And I had a lot of classmates who had a lot of, crazy breakdowns, and, people deal with, hardships and challenges differently. But I feel like those years that I had really helped me in the long run, because I learned how to emotionally handle things better. So even though it did feel like Niagara Falls in the beginning, I am enjoying the view now, in a sense. And then the second thing goes along with kind of being out of school, but making friends was another worry. As someone who's super anxious about finding people and making new friends, I think that was really challenging for me because I didn't know what kind of people I wanted around me. So I think it's one of the worries that I hear about PA students for incoming, but I think as long as you know what kind of people you want to be surrounded by, what kind of person you are, I think you'll just be fine.
I know we have a PA educator. Any advice from that perspective for students?
I think that Joe's advice about being very level-headed about everything, and actually when I'm on an admissions committee, I like the non-traditional students because I feel like they're more grounded, they're more mature, they're more likely to survive PA school without any issues. And they bring a lot to the table. And so I know a lot of people are worried about, I didn't come straight out of undergrad, or, whatever, it took me longer to get here. That's a strength. I 100% agree with that. The other thing is just making sure that you prioritize your learning, because I feel like you had this expectation that you had to know everything about medicine, and you have to know enough to, not kill patients, number one, but then number two, to pass the pants. But you will be learning medicine for the rest of your life. And if you think you went to PA school and now you know everything that you need to know, that is not true. You're just going to keep learning, which is what I love about being a PA and being in medicine, is that you're constantly learning new things, which is really nice. You will get to a point when you've been practicing for a while, depending on what specialty you enter, where you'll start to feel really comfortable. And for me, that's the point where I'm like, okay, now it's time for me to switch specialties because I want to learn something different, which is the great thing about being a PA. And that's just my personality. Some people really like they get their groove on, and then that's their specialty, and then they stay there. So you have the other thing I think for PA school and for your career is you need to know who you are. So I know that I would hate trauma surgery. So that is just not my personality. I don't like chaos. I don't mind, like, I like being busy and organizing everything and working in cardio where, I'm managing all of my outpatient in the morning, and then I go to the hospital, and then I'm getting called and consults because we've got, somebody coming in with an MI and somebody else coming in an AFib with RVR, or, you've got a bunch of stuff going on. That stuff I don't mind, but I don't like seeing patients in pain. And so that part, I just knew that wasn't going to be my career. I could do it. I did my ER rotation, did great in it, but not my choice. And so it's good to know. And that's the great thing about going through PA school is you go through these rotations and you kind of get a feel for okay, yeah, this is a nice fit, or okay, nope, I don't want to do this for the rest of my life, but at least now I know, what's involved. And what's nice is you carry that knowledge with you of, what people in that specialty do and are like, and how they practice medicine. And so that's helpful for when you were, practicing in whatever field you're in.
Christine, you said that you are finishing up your first year of practice. Can you tell us a little about what it was like to transition to practicing independently?
I think I could speak for majority of PAs who enter their first year of practice. It is very rigorous. It's very, the learning curve is very steep, especially since I'm in a pretty subspecialty, and I didn't actually rotate in this during school, so I came into transplant brand new. And even if I did have some minor experiences in it during school, I don't think it would have prepared me enough for it. And something I learned, speaking to other new grad PAs, is that your first 5 years, I've been told, will be very difficult, because that's the peak time of growth for you and truly becoming comfortable with becoming a clinic. But it is difficult, but also it's incredibly rewarding to be able to stand on this side now and look back at everything that, we've accomplished and realize, okay, this is what I've worked so hard for, and I'm finally living it. And there are sometimes I've had very bad shifts, and sometimes I've had amazing shifts. But being able to truly take care of someone or fix something or alleviate anything that they may be feeling is so rewarding, and it makes everything all worth it. But like Wiz said, I'm learning every single day, and I think I will continue learning every single day for the rest of my life, because I don't think I will ever get to the point where I'm like, okay, I know everything about transplant. So it's rough, but it's completely worth it.
That's such a good message. And I see someone has their hand raised. Gary, did you have a question you wanted to ask?
Hello. Hi. Can you hear me okay? Okay, perfect. I just wanted to ask a follow-up question for, I don't answer who came about it earlier, but on the topic of lateral mobility and being able to see so many different types of medicine, and then being more comfortable referring out and then building a very comprehensive care team for a patient. I wanted to ask more about however, PA education is unique in that way, in terms of letting PAs get enough exposure to different fields, letting them create very well-rounded care teams because of their different experiences and different specialties. I ask because I think that's a big reason why I'm in the middle of like finishing up my personal statements right now, and I'm just moving things around constantly. But I think that the point that I'm revolving around is the fact that I've met a lot of wonderful providers, like physical therapy in the field of nursing, in hospice and whatnot, and I have a lot of trust in them, and I think in a way it kind of motivated me to go back to PA school, because that's the education that I prefer, and that's the education that I personally want under my belt. But yeah, sorry, I hope that got to make sense.
I
Okay,
think,
so
I think that
go
was
ahead.
for, I think that was for you, Nguyen.
Great. But I'm happy to have anybody else jump in after I answer as well. So I don't know that I do feel like we get exposure to a lot of different rotations. Hopefully, you get the chance to sign up for different specialties. Like in every PA program, sometimes some PA programs will let you have like one elective, others will let you have two electives. Part of the reason why I think it's helpful as a PA that you are required to have, minimum 1,000 to 1,500 hours to apply is that they want you to be exposed to many different fields of medicine and to have been out there and seeing how medicine is actually practiced. And I do feel like a lot of PA programs teach a lot about interprofessional collaboration. Perhaps that's true in medical school as well. But the onus for PA programs, because you are in school for 24 to 36 months, is to get you exposed to as many things as possible in as short a period of time as possible. So I think that it's really, when you compare it to medical school, it's very much about practical knowledge quickly, so that you can help your patients as quickly as possible, so we can, which again, I said this before, which is what makes us the Swiss Army knife of the medical field.
I think the members project that PAs are the only major medical professionals in the U.S. that have to pass a recertification exam that covers the full breadth of medicine, regardless of where they practice. So, like, nurses, they don't take a test. Physicians, they just look board exams that are in their specialty. We're the only ones who have to know everything. Even if you've been practicing surgery for 20 years, still have to study pediatrics. So I think that's something that makes us unique.
And the other great thing is that we treat patients from birth to death. So some adult NPs, they don't treat pediatric patients. So it's very much about whatever their certification is for. Some NPs are only like psych NPs. Ours is very broad spectrum, which I think is great. It makes us, again, very versatile.
That was a great question. If you have any that you want to jump in and ask, feel free to. Otherwise, we can talk about it.
I think her hand is up again.
Sorry, I forgot to lower it. Thank you so much for your response. Appreciate it.
Awesome. Thanks, Alex. Great. So I wanted to ask you a little about your unique path. Luina was saying like she finds like more mature students to be like even stronger and more resilient in PA school. But I also would love for you to tell your story about how you got into becoming a PA.
Sure, I could talk about that. I would like to, like, one of my favorite quotes is, knowing your why can conquer any what or any how. And when we were talking about like going through PA school and how rigorous it is and why, it's just, that whole process in itself, I think, makes you very resilient. And so I think like my personal story has to do with a lot of resilience. And, for me, my non-traditional path started with me finishing and working in finance. I was an accountant for about 5 years. I worked for a tech company and I really liked it. But I knew that I could be contributing more. I mean, as an accountant, it's like when you're like day to day, you're doing like 50 hours a week, looking at spreadsheets, like you're just counting someone's money at the end of the day. And it's like, for me personally, I would rather spend that time like doing something positive and doing something that could help people, you know. So I was looking for that. And when I left finance in 2019, I used like my leftover money and I invested like in an EMT certification with like maybe like, you know, going into that, being in an ambulance, I can at least like learn like what I wanted to do and what made me happy. And then right around the trend of 2020, like, you know, the rest of the story happened with the pandemic. And a lot of people who worked in healthcare because of the pandemic was turned away from that. And for me, I really enjoyed that for some reason. And that's how I knew that this is something that I wanted to do. And at first, PA was actually not my first choice, mostly because I didn't know enough about it. I actually wanted to go into nursing. And part of that is me being Filipino, and my mom, like, she just really wanted me to be a nurse. She was telling me, like, oh, they have job security. There's so many, you know, nurses that I know, like, you know, so many people in your family that are nurses. I'm like, okay, I'll think about that. I'll, like, do all the prerequisites. And it wasn't until I volunteered at a COVID-19 test site at Charles Drew that I was exposed to the PA profession. The shift manager for the COVID test site was a PA. And they told me about it, and like, hey, you should consider it. And it made sense to me because I already had a bachelor's degree. If I wanted to go into become a nurse practitioner, I would have to get my BSN in nursing. And I was like, do I really need to do bachelor's? You know? And so I thought about applying to nursing just as a backup. And then I went into PA school like pretty hard. And then I found out that I didn't get in anywhere in California, which is where I'm from. And so, but I did get into nursing school. And I started nursing, and I was about 5 months in when I actually got my first interview through my one program that I applied at State. And it was a pretty late interview, as in like the next CASTA cycle had already opened. I had already submitted my application to a couple of schools again in California. And then I found out that I got into PA school. So I dropped nursing school. I went into PA school, and then that was like one of the hardest things I've ever had to do because I had to move across the country. And it's like, I didn't know anyone where I moved. The only people that I knew were like the people in my cohort and the professors. And so it's like really hard for someone to like, you know, really read your like strong supportive network, you know, your support system, and then go into a place where it's like, I don't know anybody. And then also there wasn't that much good agency. And like, you know, that was one of the things that like I used to like help me, you know, like whenever I had a tough time, I usually need like some good food that's look better. And so that was really hard. But then I made friends when I was in my cohort, and then I talked to my family a lot, and I feel like, you know, distance really makes the heart go fonder. And so even though I was far away, like these check-ins with my parents made me like my relationship that much stronger. And so that really kept me going. And then knowing that like, you know, whenever I learn about like a medical disease, like it's a lot, but when you see this condition and like, you know, someone that you love, like my mom and my dad, it makes you really want to learn about it more, because then it's like, oh, I know exactly what's going on. I know which medication you should be on, or I know what's causing this, and I can really make a difference in this person. And it starts with that. And then, you know, then you have like a friend that has like this condition, and then like it just keeps expanding. So it's like, yeah, I continue learning every day, and like, even though I just finished PA school, even though I just finished the PANS, I'm still learning every single day. And the expectation is that I will continue to learn throughout the career. And that's something, I guess, that keeps me young, because like, you know, I continue to challenge myself in this profession. So like, I'm really thankful and grateful that I got into PA school, and I'm really thankful that I became a PA. And I think it's just the right like program for me, because like, yes, the lateral mobility, I can practice anything I really, really want to. I could teach if I really wanted to. I can do research if I wanted to. I can go into business and think about AI and do all that stuff if I wanted to. And like the possibilities are endless. But the fact that like, you know, you finish like the 24-month to like 36-month program, depending on where you end up going, like it's such a valuable thing. And yeah, I just hope that you guys all eventually apply and make it too.
Thanks for sharing, Fritz. I'm happy you made it to. I was curious about you and what motivated you to move from clinical practice to entrepreneurship,
Clinical practice to entrepreneurship.
or whatever you do.
It's an endless hitting the ceiling. Basically, that's how I would describe it. Like every time that you learn something, and then you obviously I would never claim that I perfected certain things, right? But I would say that I hit to a point where it got boring, and I keep pushing for more, and which is why like the whole journey of trauma, and then between the primary care. So at one point working like 6-7 days a week, to like neurosurgery, and then there was also a transition between family medicine and neurosurgery because I would always be working 6 to 7 days a week. That's like my go-to thing. And sometimes like even with trauma surgery, I'd have a 24 hours, and then I would go to primary care. I would be working a whole like another day. And that's because I saved, like that was one point where I saved someone, and then like I got so much adrenaline that I was like, okay, I'm gonna go to my next job. Didn't care. And then I pretty much hallucinated after when I was sleeping. Apparently, I woke up and said, don't touch the surgical site. And I didn't realize what I said. So at one point I was like, oh, this is not good. I shouldn't be doing that. But entrepreneurship to me felt like it's important because, well, one, I didn't see a lot of Chinese American PAs in the community that's in leadership, to me, at least in my community. And so like that was always like a motivating factor. And then like the second thing is I didn't know a lot about how the economics of healthcare work in terms of like how is Medicare, how is Medicaid funded, how is commercial funded, like how does that dollar gets trickled down into different provider groups, like what's the force between provider groups, health system, and insurances. And so there's a lot to learn over there because there's a lot of different variables, and which is why like, you know, why there's news about denials, there's news about like certain health plan is leaving certain system, right? Because that's all part of like negotiating. The economics don't work, right? And so like, I wanted to know every aspect of healthcare from contracting with the payers to credentialing, and how credentialing impacts like our credentials. Every time we write a progress note, right there, you have to bill, right? How does that bill gets to the health plan? And then how does the health plan know you're with X, Y, and Z group, and how much to pay, how much to reimburse? And then within all this system, there's a lot of areas where things can go haywire in terms of like, it's not just denial, it's just like the message is not going through the clearinghouse. Or like somehow your credentialing's incorrect and therefore you're denied because you're out of network. So like there's a lot of areas where I didn't know about. Therefore I went into that route just to learn that healthcare side of the equation, the insurance side of the equation, and then also at the end of the day understand how medical practice is run and the components of starting a medical practice. And then like everything kind of like one thing led to another after building clinical programs for an organization in New York City called House Call Program, where we sent PAs in the community and actually started a business doing that too. That led to more opportunities where, because for me, it's not just building the system, is how do I pass that on? So I build it, I appoint someone to lead it, and then I move on to the next project. And the next project was building another practice. But instead of a house call program, this was about building a medical practice. So what are the components I need? I need doctors, PAs, I need contracts, I need like all this stuff I didn't know. So I have to learn, like I know the practice side, right? But because I know the practice side, I have some idea of what the administrative side would look like. But I had to like learn on the fly and like kind of ask folks that run practices how they would do certain things, and then eventually, like I started learning how to do the matrix model, where each and every aspect of a practice, I would have like a subject matter expert, and then I will be the glue and coordinating and getting this project going. And one thing led to that became a real practice, and then we were seeing a lot of patients within like 6 months already. And then now it's more like that led to even more doors opening into the digital health space, like me doing syndication deals of investing in startups, and working with different verticals in healthcare, like urgent cares, lab space, like other medical practices. So I don't know whether that answered your question, but I felt like that opened even more of a box. But it's why I did that, because I'm just a very curious person. I love new things. I love being a pioneer to something that's like a position like me doesn't really exist, and being like a very rare item in the market is very important to me. Not like almost like back then when I went to business school, having PAs with MBAs is not a lot. Now there's a lot of them. So like I hate that. So now like when people are asking me like should I get an MBA? I'm like, well, just run a business and you'll be fine. Cause like what's the value at this? Everyone's like everyone's getting an MBA. So like there's no value to that anymore. So like you can't stand out. It's hard to stand out. And the only way you could stand out is like you have these small projects that you've done and get it to A to Z, and then you're known for something like that. So I hope that answered your question. I'm sorry.
Yeah, absolutely. For Fritz and Alex backgrounds, like I know Fritz, you were like an accountant before. Like, do you see some of those skills that you gained as an accountant going into your practice as a PA? And then Alex, do you see skills from being a PA go into your practice in business?
As a treasurer.
Yeah, I was going to say naturally it made me change it. Yeah, I mean, it helped me stay organized during PA school. Like, I was really good with spreadsheets. So, like, for example, for my program, I had made this spreadsheet for everyone to fill out their clinical rotations, like when they were having them and where. So that, like, for example, if someone had a later rotation, and then they can go onto the spreadsheet and be like, oh, Fritz had this rotation for rotation 1. I could ask them for like, advice on like how this doctor or this preceptor wants things set up, So that was really cool. Other thing was like also budgeting, because so I don't think they tell you this, but like once you're in TA school, like yes, you have student loans, right? But student loans, like they cover as much as you think you will need, but you're gonna need a lot more than what they actually tell you. And it's like, for me, it's like, now that I'm done with TA school, I finished like end of May, right? And now it's like end of July. I just got my certification, but I still can't work yet because I need to go through licensure, right? So they don't tell you is that your student loans, they end and they cover you until end of May. Now I'm like, how am I going to survive June? How am I going to survive July? How am I going to survive August and September? It's like, you still have to pay rent and you still have to, pay your card bill. You have to feed yourself. And so it's like, okay, so what do you do now? Like, how do you survive this whole thing where like you don't really have a job? And then also like, do I go back working as an EMT? It's like, now like I have all this skill and all this knowledge as a PA, and like, can I go back and working as an EMT? It's like I can do all this, but I'm only an EMT. I cannot like, I don't know. It's kind of like that. Part of it is like you got this. I guess again, it's like, is it beneath me now? Like, can I go back to making $15 an hour, knowing what I know? Like, is it really worth my time doing all that? But at the same time, it's like, right up to pay. The only reason why I was able to go back to LA and visit my family and sometimes my parents is like I used points to pay for my flight, right? So it was like all these like problems that like I feel like all of my people in my cohort probably didn't think about, but because I was an accountant, like I have like an emergency fund to like help me get through to this until this point where like I'm credentialed. And that's another thing, credential.
Yep.
Like, people don't tell you like, oh, it costs like $500 just to apply in the state of Virginia. And it's another $500 to apply for your DEA license, right? And it's like, well, that wasn't covered in my student loans. So yeah, I mean, it's scary, but because I had this background as an accountant, I was like, I'm ready, I'm prepared, I'll be okay. So yeah.
I think DA is 800. No, 500. No, it's $800.
It's probably 800. I'm still waiting for Virginia to approve me, and then I can apply for it. So yeah, it's probably in the 800.
Yeah, and credential, and then once you get that, then you can credential. So you don't have all that stuff, you can't even credential yet.
Right, you can't even work.
Yeah.
Like I have all this knowledge, what can I do with it? Absolutely nothing.
Yeah, curious to know like what's the real time. I think it would be like 6 months, to be frank. Yeah, it's probably 6 months.
I'm sitting on 2 months right now.
I think it's 6 months.
Yeah. It'll tell you that.
Yeah. Well, sorry, what was my question again?
Are there any skills that you learned in family med or surgery that you use now?
Oh yeah, trauma surgery. Everything is puzzles. Everything I do is pieces of the puzzle, and so like I can keep track of people I meet, deals I see, technologies I see, companies I see, and then I can see a strategic partnership and I pair them together, or like there's an opportunity here in which I'm just missing X, Y, and Z, and now I have the full picture. Then I'll act on it. So I'll always have like, in my head, I'll have like 100 different like photos that's like, there's still some missing pieces, but I'll remember them, even if it's connections. Like if I need, I don't know, I'm just gonna make something up. If I need like accountant help or something, I'll be like, oh, Fritz, or like if I need, like, and I have a bunch of others that I can like go through my Rolodex, but like that's how trauma prepared me, because I can triage, and within all this I can triage too, because I can see like what's more important, what's more real time, what's would change, what's life changing, what's not life changing. So that's a skill set that you don't lose, and you know, it helps you in life. I've written about that too. Yeah, and neurosurgery is all check boxes and just getting things done. So like, that's the other one.
Awesome. We're about to go into our Q&A, but before, I really wanted to hear just from anyone, what do you think is gonna, where do you think our profession's heading in the future? And what makes you excited about the future for the PA profession?
I can start. I think from a primary care standpoint, I started communicating this to people, but I think from a primary care standpoint, it's going to be mostly PAs and NPs taking over. A lot of the shift would be physicians more on the specialty side. There's going to be more activity when it comes to PA autonomy, specifically on primary care. And like, for example, there's a bill out in the state of New York where they're allowing non-physicians to own a minority share of a professional corporation of a physician. That's, you know, that's usually, that was against this CPOM, the Corporate Practice of Medicine. But now that's a bill that's starting to be introduced. So it's allowing other folks to own practice. You can own practices now and indirectly in a certain way. But that is becoming more of a trend. NPs had got the really boost, a faster boost from their lobbying efforts through, and then able to push some of that legislation through many different states, especially in the state of New York as well too. So that's what I see the difference, and that trend, at least in coming 5 years. That's how soon I see it.
I think that there's a lot of truth in that. In the state of New Mexico already, PAs can own, they have independent practice after 3 years of full-time practice. Because it's a very rural area and they have a hard time getting providers out there. I think where nursing and PAs end up being not at odds, but what differs in terms of their progress versus ours is that PAs at first they don't want to mess with the PA physician relationship all the time, and so they're concerned that legislation that would damage that relationship is something that originally, years ago, that they were afraid to join that type of legislation. But as more and more physicians no longer own their own practice, and companies now own a lot of hospitals and practices, and physicians are employees themselves, I think PAs are seeing the writing on the wall that we need to fight for our own profession and not just worry about the physicians and what are they going to say, what if they won't hire us, you know. But the only way to move that needle forward for PAs to have that kind of practice is if you join your state organization the national organization, because the reason why nurses are more powerful than us is they have more money. They have more numbers, and then all of their nurses, when there's a problem, they all join together and they work together to further the nursing profession. So that's what we need to do, is that we need to band together to advance the PA profession. I see the PA Compact, which is on 29 states now, being a huge benefit for our profession in terms of mobility. And I think that'll be helpful. The problem now is that PA practice differs somewhat from state to state in terms of what you can and can't do. I mean, once we have more of the compacts, then that's going to lead to more of the standardization of PA practice across the United States. And then we'll spread globally, hopefully. And, you know, that's something that PAs and Nation Health hopefully can help to build as well.
I agree with everything Alex and Lynn said. Having served on the House of Delegates as a student delegate 2 years ago, I think one of the biggest talking points is whether or not we should advance our degree to a doctorate degree. And that's always just been a very polarizing topic, but I think it's just naturally the progression of our profession, as you know, PTs and OTs have also become a doctorate degree as their terminal degree. I think PAs will naturally follow that as well. But I think the future is bright, and for other pre-PAs here, if you're interested in becoming PA, chose the amazing career. The growth is astronomical. I am so excited. As you can see, our profession is rooted in advocacy, and there's so much work behind the scene that goes into, you know, better patient care for all and advancing our profession. So I'm very excited to see what's in store for all of us.
Any other thoughts on that last question? If not, I'll pass it on to Danielle. We're going to go do some Q&A.
Everybody was sharing such rich experiences. And for those who have already asked questions, thank you for asking them. With the Q&A, feel free to think about what you're curious about in regards to not just the experiences that have already been touched upon today, but also just like asking our different panelists about the foresight that they see within their respective professions. So obviously what we've heard today shows that PA do more than just practice with patients, but also covering like the business side of healthcare, covering education, covering research, and then of course, navigating education as students as well. So for all of you who are here today as participants, think about what you want to learn most, especially with the next about like 27 minutes that we have. And think about what you want to ask each of these panelists in terms of not just their experiences, but what they see coming up for the future, what they've experienced prior that has not been talked about so far. And then on top of that, maybe even just questioning what what are the things that they're experiencing now, especially as their respective roles continue to evolve. And we've touched upon the different ways that PAs in general have evolved within the US. I like the point that Moon made regarding PAs being able to practice globally, just because when I first found out about PAs, there wasn't many countries that allowed them to practice. But yeah, feel free to unmute yourselves. Feel free to type it in the chat. I know sometimes it's scary to unmute or even turn on your cameras. So yeah. And then Jenny, I see that your hand is raised. Do you have a question for right now?
I'm talking, we have the question for Alex. Like you were talking about, I was wondering what was the name of the business that you mentioned. I spent it in the chat.
Okay, I think the question was what the business was. It was house call business. It's basically a program I formed within a company called, which is a former IPA, the Independent Practice Association. Yeah, and then other one is Render. So I built one of their house call program within Render. So it's one of the largest singleton meaning single medical group primary care practice. Is that a sufficient answer? I'm saying silence is yes then.
I'm currently driving. Thank you so much.
Drive safe.
I'm curious to see how many people here are already members of PAs Nation Health. Can you raise your hand? I mean, besides the board. Okay, we've got a question in the chat, it looks like.
Yeah, so it says, how could I be a competitive PA school applicant? Thank you, my panelists want to share.
Can you share a little bit about your background?
Hello. I'm currently a freshman in the university. I'm going to start this fall semester, and I'm exploring the different healthcare career paths. And I was wondering what I could do, or how can I start from now to prepare if I want to go here.
I'll start. One of the things, actually, there's numerous things that we look for. We look for people who have leadership experience, people who have advocacy experience, and people who, even if you have research experience and life experience. So as a freshman, it's sometimes you might look at that and think, well, how do I get all of that experience? The way to do that is you look for the opportunities that match what you're passionate about. So what's your major going to be? Do you know? And tell us how to pronounce your name. Is it Junior?
Hello?
Yes. Go ahead. We can hear you now.
Yes. Okay,
Oh, it might be a Wi-Fi issue.
here.
Yeah, maybe type it in the chat. We're having a little trouble hearing you. Do you want to try again? Okay. Go ahead and type it in the chat.
Biology.
So your major is biology, which is like every other PA. So, or pre-PA. So what you're looking for is a way to stand out. A way to stand out is to look and see if there's anybody in your university that maybe is offering research opportunity. There are fellowships that are available that you can look at. A job in a lab. If there's something that you're passionate about. I know when I when I first started in college, I was going to be a journalist. My goal was to be rooting out all the corruption and evil in the world and exposing the light of truth to everything. And then I discovered neuropsychology in the brain and realized that that was something I was really passionate about. So I found a job in a lab and tried to get into research at that point. Didn't know anything about the PA profession. And then, again, different PA programs do things a little bit differently. They either get like points for either research. Some PA programs will give you points for being an EMT or a paramedic. If you have military service, you may get extra points for that. The other thing is advocacy, because as a PA, one of the things that you're going to have to do is you're going to be advocating for your patients. And so they're going to look for people who don't just have good grades, but also people who are willing to fight for their patients. And so the volunteer work is really helpful, looking at are you serving your community. I'm going to do a shameless plug for PAs and Asian Health as us being a national organization. we are always looking for volunteers. And you can be a pre-PA, as Danielle showed. And her fabulous work on this is something that she can list on her resume as and in her application as leadership work that she's done, which is going to help make her stand out as an applicant as well. So I understand not everybody's situation is possible, and so like if you're taking care of a sick family member or something like that, and you're trying to, get through everything, showing that you can triumph over adversity as part of your application is also something that PA professions will look at, or PA programs will look at. And then I've talked about this in other webinars. You want to be looking at how you can, like joining the PA, your PA state organization as a pre-PA. Not everybody does that, and that's going to help you stand out as well. So all of these different ways are ways that you can definitely stand out as an applicant. Hopefully that helps you.
Thank you for your questions, and thank you for the insight, Lynn and everybody else. We have about, I want to say 18 minutes, but depending on the announcements that we have at the end, I'm just going to encourage y'all to continuously pour out any questions that you have for our panelists. On top of that, if you're curious about what we do at PAH, feel free to ask about that as well, especially now that we have our plugs in the chat, and of course, we'll be talking about that in a couple minutes.
I have a question about going into practice. I'm worried about having good relationships with my coworkers. Do you have any advice for that? Because I think having a really strong relationship with your collaborating position and the nurses on your team, that's super important. Do you have any advice in general, as a new grad PA, them knowing that you're going to have a lot to learn and managing that at the same time?
I think, go ahead, Alex.
First, nurses are your allies. Don't make them your enemy. They can make your day really well or nightmare. So I think it's very important that you maintain great relationship with your nurse. A lot of communication with your attendings. You will notice that I noticed a lot of PAs would tell me, be like, oh, my attendings don't let me do stuff, blah, 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 blah. Dude, how long you been there? 3 months. Come on, it takes longer to build a strong relationship. With me and my attending back then in trauma, we're still very close. I still talk to them today. One of them just came back and became the system director for NYU, and so I just met up with him 2 weeks ago. And he was just sharing with me what he's doing over, when he was at Grady. He was the EVP in Grady too. So it's important to keep that relationship, because once you have that strong foundation, then they'll trust your judgment. They need to see your judgment. They need to witness it. And if you communicate more with your attending, not just about just the case itself, but also have them understand your thought process and why you're doing certain things, then they'll start having more, okay, this person is actually thinking. They're not just oh, because of the guideline, right? It's and then you have to understand why this guideline exists. So having that type of relationship and being able to have open dialogue and candid dialogue with your attending will help you grow both professionally and be better a PA. And at the same time, your attending will step back even more. Yeah, at one point, I will be running the trauma, and that will be me and the junior resident or the third year resident. And then they're looking at me, I'm in the beginning it was kind of scary, but later on you just get used to it. And then if you need them right away, you call them, be like, I just want you to come down, and they don't have to say anything else, and they'll come down right away, because I understand what my limitations are. So
I think it's important also to do your homework. So you always have to be prepared. I recently had surgery on my wrist because of the fall, and the surgical resident clearly had not read up about the surgery ahead of time. I did a wide awake surgery with a distal radius repair, which was super cool that I got to watch my own surgery on my own wrist. And so I got to hear everything that the surgeon was saying to the resident who did not know at all some of the answers to the questions that were being asked. So be prepared, always be prepared, number one. Number two, be humble. As Alex was saying, you know, if you go in and you're expecting all of these things and you've only been there for 3 months, again, you haven't developed that relationship, you haven't developed the trust. Yes, they picked you to work for them and with them, but they also, you know, want to know like how much can they trust you to take care of the patients, because, you know, they don't want the liability. And then thirdly, be kind. Be kind to everybody, because you don't know what people are going through. You don't know what is in the background. And so don't try to assume good intentions of everybody who you come in contact with, and give people grace, because like I said, you just don't know what they're going through. And that kindness will come back to pay you back. Not because you're looking for payback, but because you have taken the time to treat somebody like a human being, and you know, you've developed that relationship. And it's all about medicine, just like any other profession, is all about the relationships, but any more so than any other time, because a lot of times, and Fritz can talk about this with his background as an EMT, you are meeting people on some of the worst days of their lives. And they need you to be kind, and they will remember what you say to them, and they will remember how you spoke to them, not just what you said, but how you said what you said. So I think that if you do all of those things, you will do fine.
Those were fantastic responses. I'm going to ask the question to all of you as a pre-PA myself, especially considering that healthcare is just continuously evolving these last few years. You know, like policies just being overturned, AI is entering. I'm curious for all of you, what is helping you all stay grounded, especially in terms of not burning out, not considering instant changes to your specialties or what you're doing, or even just like what's triggering some curiosity in you all to explore other options too.
I will say I don't know what burnout is. I never experienced it, and I think those that experience it, to me, everything I do is very fun and enjoy. If you didn't find it fun, then like maybe I'll be burnt out then. You know, like working 36 hours at one time, I wasn't burnt. I was like exhausted, like physically, but I don't think I was burnt out. Yeah.
I would
Thank
say
you.
actually a bit too early to feel burnout. I feel exhaustion many times, but burnout isn't. Like thankfully, I haven't felt it yet within my first year of practice. I know it's not the same for some of my other colleagues. But what helps me stay grounded is the fact that I love what I do. I love transplant medicine. I think it's so fascinating, and I have such a great team supporting me. I have great other PAs, I have great attendings, I have great managers, and that is probably like the most important thing. I think I could do any specialty as long as I have a great team supporting me. And to like Leslie's question before, definitely like when you're interviewing, I've gone through numerous interviews where I've felt the vibes of the chief PA and the general turnover rate around like with the staff, and when something's not right, you kind of just know, and those were the jobs I passed on. But when this job came around and I met everyone, it just felt like the right fit. So definitely the people around me is what keeps me grounded.
I think that remembering your why is super helpful. And so, as Fritz said, if you remember why you're doing it, that helps to avoid burnout. The other thing is, again, because of the flexibility of our profession, if you're in a bad situation, you can always find another job somewhere else. Because, I feel like there is a lot of talk online, especially like I'm in the PAHOMS group, and there are a lot of people who maybe are juggling family and the house and being married and there's a lot of responsibilities that can go on. And people talk a lot about work-life balance. I think that again, it's important to remember that number one, you have to take care of yourself. So get the rest, even if Alex says you don't need more than 24 hours. So make sure that you're being healthy. But then the other thing is just making the time to figure out what's your end goal, right? So if you don't have and I'm a long-term planner, so even if you don't find joy in that particular job right at that moment, you can find joy in other things. Like for me, starting a PA for Asian House and getting it moving again, just brought me so much happiness to be able to help create this community. Getting involved in all these other types of, and there's so many different organizations that you can become a part of. If the people that you work with aren't people that necessarily you want to, hang out with after work, that's okay too. Your work family doesn't have to be your, your buddies. As long as you've got good people in your life, in your personal life. But I think it's when you make your whole life really about work and then you don't have any balance, those are the people who burn out. And then the other thing is, again, that mismatch between who you are and the profession or the field that you choose. I didn't think I'd like cardiology, but I like that nurturing, one-on-one with the patients. And then I got chosen for a job at the VA in environmental medicine. And I really like the veteran population. I like this federal system. And then working in consult nephrology. So nephrologists, I thought cardiologists were nerdy, but nephrologists, super nerdy. And then I went into genetics and I was like, hey, these are not only the nerdy people, but they're also super quirky at the same time. So okay, I think these are my tribe. So sometimes it takes a little while to figure out who's your tribe. I knew ER PAs and ortho, that's not my tribe. But you never know. That might be who you are and that's what you like. Then you're going to be happier when you're in a field or a specialty or in a practice that suits your personality. And it's okay to, try to find that fit first.
Thank you for sharing. Jenny, I see your arm. Your hand is raised.
Hello. Sorry. Thank you very much for your patience. I finally worked. I had a question for Fred. I had a question about nursing in terms of pursuing an ABN before going into PA school. Just because I do feel like my attention is drawn to many things at the same time. I see myself jumping around in specialties and whatnot. And I have met a few PAs who were nurses first, and they have no regrets. They love the stability. They love the populations they were able to see. But there was some curiosity about the PA education that led them toward that way, and they don't have any regrets on the way that they pursued their education. But as someone who is 2 years out from undergrad and applying for PA school for the first time, a lot of my friends are telling me that I'm just very nervous and overthinking it, and they're telling me to go PA right away. But I've also met some amazing nurses, and I really love working with them as well. So I'm at this weird point where I genuinely do not know if I'm overthinking it. But yeah, I would love to hear your advice. Thank you so much.
I think the imposter syndrome was strong within me, and even after I'm done with PA school, even after passing the plan, I spoke going, what am I doing, and do I know what? So, but to answer your question regarding the ADN, so if you guys didn't know, ADN stands for an associate's degree in nursing. So again, since you are 2 years away from undergrad, you've already gotten your bachelor's, that's fine. But if you're gonna use your ADN as a way to use it as a step towards applying to PA school, just see now that PA programs require at a minimum a bachelor's degree. So if you're gonna get an ADN and you don't have a bachelor's degree, then you might as well get an ABSN or accelerated bachelor's full nursing degree. But the advantage of doing an ADN is that it's really affordable, it's really cheap, and it's really quick. I think I think a ADN program is typically about 2 years, and then you are already working as a nurse. But just so you know that a lot of like major like health networks, like the Kaisers and like the Centeras in the world, they're moving away from using ADNs. And if you had an ADN, they're pushing people to get their BSN. So I think for you, since you already have a bachelor's degree, I think I don't think you need to get an ADN. If you want to, if you're looking for more of becoming more of a competitive applicant for PA school, I always focus on your weaknesses. So if your GPA was lower end, I would retake some classes to, boost up that GPA. And like also think of a program that you really, really want to go to. Usually it's like the program that's like down the street or like locally to you. And then if they have whatever closest PA program is to you, and then look at their matriculation class, and then compare yourself to that matriculant class. Meaning that like, is my GPA better or on par with the people that got it? Is my patient care hours better or on par with the people that got it? And on top of that, if you are, then we can talk about the things that Nguyen said, like, did you do research? Did you volunteer? Did you do any advocacy work? These are the things that'll separate you. But first, you need to make sure that your fundamentals are good, meaning like the basis of your application are good enough for you to even be considered. Because you can be like, for me personally, I'll be honest, my GPA was a 3.04. And the minimum requirements to get in or even be considered in a lot of PA schools is me to have a minimum of a 3.0 GPA. And so it's like, well, I have all these other things. Like I have over 4,000 hours of being an EMT for body scan, whatever. I volunteer, I was part of Kappa, I helped the challenge. Well, I had all these like extracurricular things. But if they can't overcome the idea that your GPA is on the lower end of things, you might not even get an interview. Because a lot of these PA programs, what they're worried about is when I choose this PA student to be a part of this program, how successful are they going to be, and how successful are they going to, be in terms of like passing the pants, right? Because they don't want to take a risk on a student and then have that student fail out and then their pants rates go down, right? Because that's not even people will consider. So instead of like focusing on doing an ADN, I was focused on the weaknesses to make your application like stronger. Especially if your focus is to become go to PA, like go the PA route and go for it. But if you want to like go into MP or if you're not sure, then like maybe ADN is the route for you. I know there were a couple of pre-PAs that I meant to pass, and they were like on the fourth cycle of applying the PA still, and they just started to get in. They couldn't get over that hump where they couldn't get an interview, and now they're in nursing school, and like they're about to be done. And like, what I would hate is for someone to just keep reapplying and reapplying and reapplying. And then by the time they're like, reapplying again, it's like they could have just gone to nursing school and gone in, it would have been peaceful. So you really have to like, again, be honest with yourself, see where your weaknesses are, address those, and then, go from there. Hopefully that answers your question.
Thank you so much. I think I'll go forward and apply to PA school at least one time, and then second cycle I might apply for nursing and PA the second time. And I love both careers. I think my preference will always be for PA, but I don't know. I'm a little anxious. I do want to get started, and I've met a few nurses who went the PA route, and they're so happy with where they ended up. So yeah, thank you so much. Appreciate it. Thank you.
Coming from someone who did both, I totally understand where you're coming from. It's totally okay to go one way or the other. It just, as long as where you end up where you want to be, get to practice the medicine that you want to do, and get to help the people that you want to help.
Amazing questions and answers today, y'all. So we're a little bit over time. We went over by 1 minute. As I said in the chat, I'm going to wrap up the slide deck. If you have any questions for our panelists, I'll probably be sending out contact information for those who are able to share it. And then, of course, with these next few slides, I just want to remind y'all, especially as participants today, thank you for joining us to the last 3 workshops. We are announcing that our membership has moved to a platform called Give Butter. We will be sharing that link. I will be sending it out on the follow-up emails to you all, including another link to a survey that will provide feedback for you all to just like give us some advice on what you want to see for future workshops, any feedback on speakers, what you want to see in the future, as well as any pluses and deltas that you have for us. And then next slide, please. And of course, if you're interested in the committees, we have the link right there. I'll also be sharing that in the follow-up email. If you're interested in contacting us about joining the Student Alliance, Leslie is your pinpoint person. If you're interested in getting involved with outreach, I'm your pinpoint person. And then of course, we also have our leads for membership and Student Alliance President, Melissa and Chai. Their pictures are featured right there with their contact information. We'll be sharing that as well in the follow-up email. And then for our panelists, thank you for sharing your wisdom, your experience, all of the knowledge, and all of the insight that you can provide to our participants, especially since many of them are pre-PA. But before we wrap up, we're going to take a quick screenshot photo. And then after that, we can all log off. We'll send a follow-up email to all the participants. I will take the screenshot right now. So if any of y'all are open to, just like turning on your cam, like, there we go. Turning on your cam, I'll take a screenshot. I'll let y'all know when I'm doing it. And then we head on out. Thank y'all.
Can you actually see everyone? Like, I only see
Not
like.
everybody.
I wonder
I'm
where.
going to be moving along pages working. Yeah. All right, everybody ready? Okay, I took one, and then I'm gonna do another one. Where can you cross the different? Okay, I'm gonna do a second one. Perfect. All right. We will see you all hopefully in the fall when we start doing more workshops online. And then on top of that, when we start doing more local activities and events, we'll be in touch. So all of you will be receiving emails. Once again, for our panelists and our moderator, thank you all for contributing your time. And have a good weekend. Have a good Friday. We'll touch base later on.
Yes, thank you, everybody. And make sure you sign up on gift letters so that you don't miss out on the opportunity for more of these types of events.
Yeah.
Thank you, everyone.
All right.